Good afternoon. I'm Dr. Jyoti Bajpai. I'm the lead for medical and precision oncology at Apollo Hospitals, Mumbai and entire Maharashtra. I'm very passionate about rare cancers care and to treat patients in oncology with challenging situations. I'm currently also part of European Society of Medical Oncology, that is ESMO, as a core committee member for Women for Oncology and also immunotherapy and investigational immunotherapy track. I was immediate past faculty of sarcoma in ESMO. I'm also associated with the Society of Immunotherapy of Cancer, which is the biggest immuno-oncology society, SITSI, in US. So I'm a core committee member for Global Access and Impact Committee. I'm also associated with ASCO and other societies. In India, as a national, positions, I'm the current joint secretary for Indian Society of Medical and Pediatric Oncology, ISMPO. I'm the founder general secretary for Immuno-Oncology Society of India, that we call as IOSI, and working for progress of immuno-oncology in the country. And I'm the joint secretary for TYACAN, which is Teenage and Young Adult Cancer Society. These are the major roles. So my 20 plus years of experience in oncology, and past 15 years I was associated with Tata Memorial Center, wherein I worked a lot for rare cancer segment, women cancers like breast cancer and gynecological cancers, immuno-oncology and precision or personalized care. So I believe that we have made a lot of progress in oncology, and right now it is not one size fits all model which works. It is essentially everybody requires an individualized or personalized care, because every patient is different, and in spite of having a similar kind of tumor, there can be many subtypes, there can be many molecular subtypes which are furthermore refined, and hence we need to diagnose them precisely, and accordingly we need to treat them. This rare cancer initiative from Apollo, this is one of its kind, first of its kind in the country, because this is providing a dedicated clinic wherein we will handle and we will provide a safe space for all the patients who will be diagnosed with a rare cancer or ultra rare cancers, and also the patients who are diagnosed with challenging situations in oncology. So when I say rare or ultra rare cancer, some examples could be sarcoma, skin cancers, melanoma, etc., pregnancy-associated cancers, neuroendocrine cancers, mesotheliomas, then also pregnancy-related cancers. Also in common cancers, there can be some uncommon histologies, some uncommon presentations, and patients with comorbidities, like patients who are having diabetes, blood pressure, cardiac, neurological problems, they present with very challenging situations. If I give you an example of breast cancer, which is one of my major area of interest, then among the breast, there can be rare histologies like tubular, adenoid cystic, mucinous. They fall into this rare cancer category. Then there can be rare types like young breast cancer, cancer which happens less than 40 years or less than 45 years by different definitions. They are also very challenging, because we have to deal with their fertility needs, their quality of life needs, their cosmetic needs. Then pregnancy related cancer, I already told, triple negative breast cancer, cancer in elderly, which we call geriatric cancers, like more than 60 years of age. They have a very different need, because many times they are complicated by a couple of other comorbidities. They are on polypill therapies. For that reason, many times it is not possible to give the garden variety of blanket treatment. We have to precisely define their protocol, understanding their complete geriatric assessment, what kind of therapy they will tolerate, what dosages they will tolerate. So this all becomes very, very vital. So that's why this is an era where precision treatment or personalized treatment is very, very important, especially in these rare cancers or challenging situations in oncology which are having some complexities within them. I think entire Apollo team is very dedicated to provide a high quality of care to our country people, so that the people should not be feeling a requirement to fly abroad. They can get under one roof, under one umbrella, the multidisciplinary based best kind of treatment available, with the experts in the country who are also part of a couple of international guidelines. For example, I was part of international guidelines for ESMO, for SITSI, for a couple of others, for sarcoma, for gynecological immuno-oncology, for AY care, etc. So we can offer them the best kind of treatment with help of our colleagues. And not only it is the treatment of cancer, but we provide holistic care. So it is very important to understand their psychology, understand their logistics, understand their family environment, what kind of support system they are having, and then handle appropriately in an integrated manner to give them the best effects and minimize costs. So this is the very aim of this clinic, to provide one of its kind dedicated care for all the rare and ultra rare cancers and every kind of challenging or complex situations in oncology under one roof. Thank you. So we at Apollo Hospital are providing this dedicated clinic, which is labeled as rare care clinic, wherein we will be providing a multidisciplinary based expert care for all the rare and ultra rare variety of cancers and all the situations, challenging situations in oncology. These challenging situations in oncology could be under breast cancer, could be under gynecological cancers, could be under head and neck cancers, GI cancers, lung cancer, so on and so forth. Bone and soft tissue cancers as such are rare and challenging definitely. Pregnancy related cancers, neuroendocrine cancers, mesothelioma, skin cancers, melanoma and non-melanoma variety, young cancers, adolescent and young adult, or geriatric cancers with complexity. We are having expertise available. We are having phenomenal surgeons. We are having phenomenal radiation oncologists. We are having medical oncology team and precision oncology team who together work, brainstorm to provide the best kind of treatment to our patients. Thank you very much.